This was the cornerstone of their health policy for the first year of their mandate, and they have nothing to show for it. Today in question period, I talked a little bit about the NDP's listening tour, which they have been talking about since they got elected. They've talked about it in news releases, in throne speeches, and in budgets. And it's always worth listening to frontline healthcare workers, but even better is actually doing something with that information. Instead, we've repeatedly seen frontline healthcare workers come out and say that nothing has changed and they are not feeling heard. As we learned through FIPA, there have been not as much as a briefing note produced in response to the listening tour, which I find surprising, that there's been no reports issued, and that the majority of the costs associated with the listening tour were for film and video production, which tells me that the listening tour was little more than a PR stunt.
Sir said there was an audio recording and there were notes taken. Also seemed to speak about privacy. And I guess by the minister's submission, there was some level of documentation. Is that not?
I doubt the minister's claims, because the FIPA that I'm happy to provide you with says that the records do not exist. Anyone who's familiar with FIPA is very familiar with the process of redacting personal information. If records existed and personal information needed to be redacted, certainly that's acceptable, but instead we were simply told that the records do not exist. And the point here is that if they've conducted a listening tour and then done nothing with the information, then they've wasted frontline healthcare workers' time. And also concerning, this was the cornerstone of their health policy for the first year of their mandate, and they have nothing to show for it.
Would those healthcare workers don't perhaps appreciate that everything they said wasn't being written down?
Confidentiality is really important, but it could have been summarized into themes. Identifying details could have been removed. Governments do this all the time. I'm really curious as to what the intent of producing video was in the first place. I don't think that video was ever necessary for this. I think what Manitobans probably expected out of this much ballyhooed listening tour was a report saying this is summarizing what we've heard and what we're going to do about it. It didn't need to include anybody's personal information. The fact that there's nothing is what's most concerning to me.
There is like a 5-bulletin news release. And the fact that it was written suggests that there would have been some notes taken.
That's what I thought, which is why we filed the FIPA and why it was so surprising that it came back with no records. They did produce a backgrounder to a news release that had, I think, 5 bullet points. And that was the summation of the listening tour that took them over a year to do. To me, that's not good enough. I think probably to the frontline healthcare workers that have participated in those interviews, that's probably not good enough. They expect to see action based on what they told the health minister.